So, Dr. Lundquist, I know you've actually had some experience using the product on your patients, and how did you come to learn about it, and in what situations you find it most effective?
Yeah, Rich. So I'm a practicing podiatrist, foot and ankle surgeon, and there are just a big subset of patients in our practices where we need really everything in the toolbox to throw at them. And so, I became aware of OrthoFreeze through, I think it was LinkedIn, and just saw some testimonials of what was going on. And I had these patients in my practice who weren't surgical candidates, who had a condition that was maybe lingering. We've tried everything. And so I started looking at topicals and started using it for a few of those patients that, there's really, I hate to say for lack of a better term, but there's not much else that we could do, and started seeing some really good benefit. I think my nurse, so I ordered the sample pack, and I think my nurse stole the biggest bottle that we got of it because her husband has chronic, hip and back pain. And she's loving it. Right. And then, so, the cases that I really concentrate on for OrthoFreeze are the plantar fasciitis patients that, you're throwing everything at them. And I tell all my plantar fasciitis patients that this is a tough condition to treat. It's a tough condition to have. I've had it personally. And so having OrthoFreeze with the topical lidocaine, topical NSAID, having that to be able to put on a patient where you're really attacking that problem from all angles, found a lot of benefit. And then, there are those surgical conditions. I had a 90-year-old lady with massive bunions come into my practice, and she was just inflamed, and she hadn't had much pain up until about a year, but these are just really inflamed for her. And it wasn't something that was surgical, but we tried the OrthoFreeze for her, and she came in and she was 95% better after about 2 weeks of using it. And yeah, that's just an anecdotal case, but it's one of those things where as a surgeon, there are a lot of things that we can correct, but there's a lot of things that we shouldn't correct. And this is one of those modalities that I think is great for patients.